Alcohol is one of the most commonly consumed substances in the world, often associated with celebrations, relaxation, and social gatherings. But behind its temporary buzz and sense of euphoria lies a darker reality: alcohol, a toxin that slowly and silently damages nearly every part of the body. While moderate drinking is often considered socially acceptable, the long-term effects of alcohol consumption can be devastating to your organs, brain, and overall health. Understanding how alcohol moves through the body reveals just how destructive it can be. The moment alcohol enters your mouth, the process of damage begins. The soft tissues in your mouth and throat are lined with mucous membranes that can absorb small amounts of alcohol directly into the bloodstream. This tissue is sensitive, and repeated exposure can irritate and inflame it, increasing the risk of oral cancers, especially in heavy drinkers. As alcohol passes down the throat, the epiglottis prevents it from entering the airway. But frequent drinking still irritates the lining of the esophagus, leading to inflammation known as esophagitis. Over time, this irritation, combined with stomach acid reflux, can greatly increase the risk of esophageal cancer. Once swallowed, alcohol travels into the stomach, where about 10 to 15% absorbed into the blood. The rest moves into the small intestine, where absorption occurs more rapidly. Drinking on an empty stomach causes alcohol to pass into the bloodstream even faster because there is no food to slow it down. Alcohol irritates the stomach lining and stimulates acid production, which can cause nausea, vomiting, and ulcers. Chronic exposure weakens the protective mucus layer of the stomach, leading to gastritis, a painful inflammation that can cause bleeding and long-term digestive issues. From the stomach and intestines, alcohol enters the bloodstream and travels to the liver, the body's main detoxification organ. The liver works tirelessly to break down toxins, including ethanol, through enzymes such as alcohol dehydrogenase. This enzyme converts ethanol into acetaldehyde, a highly toxic substance even more dangerous than alcohol itself. Another enzyme then breaks acetaldehyde down into acetate, which the body can safely eliminate. However, when someone drinks heavily or frequently, the liver cannot keep up with the toxic load. Acetaldehyde builds up, damaging liver cells and causing inflammation. Over time, this can lead to fatty liver disease, alcoholic hepatitis, fibrosis, and ultimately cirrhosis, a severe and often irreversible condition where healthy liver tissue is replaced by scar tissue. Cirrhosis impairs liver function, leading to jaundice, internal bleeding, and even liver failure. But the liver isn't the only organ that suffers. Once alcohol enters the bloodstream, it circulates throughout the body, affecting the heart, brain, kidneys, and other vital systems. In the heart, alcohol disrupts normal electrical signals and weakens the heart muscle. This can result in irregular heartbeats, known as arrhythmias, as well as a condition called alcoholic cardiomyopathy, where the heart becomes enlarged and unable to pump efficiently. Chronic heavy drinking also raises blood pressure and increases the risk of stroke and heart failure. The brain, however, is one of alcohol's most vulnerable targets. Ethanol easily crosses the blood-brain barrier, interfering with neurotransmitters, the chemicals that help brain cells communicate. Alcohol enhances the activity of GABA, a neurotransmitter that slows down brain activity, which is why drinking makes you feel relaxed or drowsy. At the same time, it suppresses glutamate, which is responsible for alertness and memory formation. This combination leads to slurred speech, poor coordination, slower reflexes, and impaired judgment. Over time, repeated alcohol exposure alters the brain's structure and chemistry, reducing gray matter and damaging the areas responsible for learning, memory, and emotional control. Chronic drinkers may develop conditions like Wernicke-Korsakoff syndrome, a severe neurological disorder caused by vitamin B1 deficiency linked to alcohol abuse. Alcohol also affects mental health. While it may temporarily reduce anxiety or stress, long-term use increases the risk of depression, anxiety disorders, and suicidal thoughts. The brain begins to rely on alcohol to produce feelings of pleasure and calm, creating a vicious cycle of dependence. Once dependence develops, quitting becomes physically and emotionally challenging, with withdrawal symptoms ranging from shaking and sweating to seizures and delirium. Another often overlooked effect of alcohol is its impact on hormones and the kidneys. Alcohol suppresses the release of an important hormone called vasopressin, also known as the antidiuretic hormone. Without enough vasopressin, the kidneys produce more urine, causing dehydration. That's why frequent urination is common when drinking, and dehydration contributes to hangover symptoms like headaches, fatigue, and dizziness. The loss of water also leads to the depletion of essential electrolytes, making it harder for the body to rehydrate. Over time, heavy drinking can damage kidney function and increase the risk of kidney disease. Alcohol's impact extends to the immune system as well. It weakens white blood cells and lowers the body's ability to fight infections. Chronic drinkers are more susceptible to illnesses such as pneumonia, tuberculosis, and other bacterial or viral infections. Alcohol also disrupts nutrient absorption in the intestines, leading to deficiencies in vital vitamins and minerals like thiamine, folate, and vitamin B12. These deficiencies further weaken immunity and cause fatigue, nerve damage, and anemia. In addition to internal damage, alcohol, a major carcinogen, the International Agency for Research on Cancer classifies it as a Group 1 carcinogen, the same category as tobacco and asbestos. Alcohol increases the risk of cancers of the mouth, throat, liver, breast, and colon. The mechanism is partly due to acetaldehyde, which binds to DNA and proteins, causing mutations that can trigger cancer growth. Even moderate drinking has been shown to raise cancer risk, especially in women, where it's linked to higher rates of breast cancer. Beyond the physical damage, alcohol takes a toll on social and emotional health. It impairs judgment, leading to accidents, violence, and risky behaviors. Alcohol-related car crashes are a leading cause of death worldwide. It can also strain relationships, contribute to job loss, and cause financial and legal problems. Over time, the emotional consequences, guilt, shame, and depression can deepen dependence, trapping people in a dangerous cycle. Although society often glamorizes drinking, the reality is that alcohol offers fleeting pleasure in exchange for long-term harm. The body treats it as a toxin from the moment it enters, and no amount of drinking is completely safe. While some people may metabolize alcohol more efficiently than others, no one is immune to its damaging effects. The more frequently and heavily someone drinks, the greater the toll on every organ system. The truth is simple yet sobering. Alcohol slowly destroys your body. It erodes your health, clouds your mind, weakens your organs, and shortens your lifespan. The temporary comfort or escape it provides cannot outweigh the long-term consequences. The best protection is moderation, or better yet, abstinence. Your liver, brain, and heart will thank you for every drink you choose not to have. Choosing health over habit isn't easy, but it's one of the most powerful decisions you can make for your future.